Everything kind of started when I felt a squishy lump underneath my jaw, and I was referred to an ear, nose, and throat specialist. There was no reason at all to go to a doctor for that, and in the end, it turned out to be a stage 4 cancer. So I've been carrying that for about 30 years without knowing.
Approximately January 2011, genetic testing had been developed so that these patients could actually get genetic tests on those nodules that is performed at the time of the actual biopsy. But if you're BRAF positive, those patients aren't typically sensitive to radioactive iodine, and it's not going to work in those individuals. So having that information prior to their surgery so they get the appropriate surgery, having that information prospectively so we know after surgery how are we going to treat those patients is vitally important.
One of the most important things that a BRAF positive person can do is get a very, very good surgeon to take out as much of the cancer as possible. That was why it was so vital for me to have a surgeon who was extremely capable and experienced, and that's what they did. They took out all of my thyroid and 66 lymph nodes. From the very beginning, when we walked in, till our relationship today, it's always been one of tremendous amount of compassion. All the little details that me, just as a person, would want, that's the kind of doctor that she's been for me. Just giving me the confidence and the care that I think she would give a family member is all I can, compare it to.
First, do no harm. We really want to get patients to get the right treatment, which can now be tailored to their specific genetics. We've never been able to do that before. In the last 2 years, that's been a very groundbreaking procedure for thyroid cancer.